most formative for me were my clinical experiences. And I remember working in that emergency department where on Friday nights and Saturday nights it was really wild. We had an unfortunate thing of having jail cells in the emergency room because we were the receiving hospital for any prisoners. And so very early on I said, I will not take care of anyone who is locked in a cell. They must be in a room because I can't observe them frequently enough. It isn't safe. So just by, water on rock and the fact that I wouldn't take care of anyone in the jail cell, we got rid of the jail cells. That became the head nurse's office. So I learned a lot in that very sort of chaotic, crisis-oriented situation, which is actually a very good place to make change. It's much harder to make change in a situation that's far more stable. Early on, I became very interested in studying what nurses actually did in their practice and making that more visible, and also so that I could improve the education of nurses, because we had a problem of lack of recognition within our own profession, the impact of all of the changes in healthcare with all of the response-based therapies and the fact that so many therapies were based on judging the patient's response to the therapy and then adjusting the dosage. I think the new nurses were frustrated because they weren't educated well enough in the actual knowledge work that they were going to be engaged in. In other words, they really needed more science, more current knowledge, and a background to understand the kind of clinical judgments that they were going to be making and clinical reasoning across time adjusting these therapies. So they had a naive view and an inadequate knowledge base. So I became very interested in how you teach that clinical judgment and also describing the nature of that knowledge, because it wasn't well captured, I think, in textbooks, and certainly there was a sort of societal blindness or lag in recognition of the level of responsibility of nurses. And I became very, very aware that we needed on-the-ground knowledge development and articulation of the knowledge embedded in nursing practice, everyday nursing practice, that wasn't yet captured either in the textbooks or in the educational goals of educators. And so I began to study the practice of nursing, and I began to really work on articulating notions of good, knowledge, and skill that nurses actualized in their practice. I think it's very important not to reduce either nursing care or medical care to a very simplified, rational, technical model, but to hold open the amount of knowledge development, experiential learning, and the import of being able to recognize changes in patients across time and adjust the therapies accordingly.